Aspirin is not a health food. It's being given out like a vitamin these days. You know, everybody should be on an aspirin a day. I've heard that. A lot of people are. We'll talk about the numbers. The numbers are absolutely staggering. 40 million pounds of aspirin are used in the United States every year. You know, that's a lot of pounds when you think about an aspirin tablet. Don't weigh too much, you know. We're talking about 20 million people in the United States being on daily aspirin right now. That equates to like 200 tablets a year for every man, woman, and child in the country. Primary benefit today of taking an aspirin a day is to prevent a heart attack, basically. Aspirin does thin the blood. There's no question about that. But there's absolutely no evidence at all that aspirin has a strengthening effect of the heart. Absolutely none. But when we look at the studies that have been done, the largest study, really when they started running with aspirin therapy as being good for your heart, that was based on a very large study. And if anybody ever bothered to read the study, what they said was that heart attacks, or MIs, were down a little bit, a certain percentage, with the people that were taking aspirin. And actually, Bayer Aspirin got a hold of the results of this study before anybody else got it. Figure that out. It's funny how that works. And they ran with it immediately, and then it did get into the media, and off you go. Well, if you read the study in its entirety, what it said was, the recommendation was that people should not take it because stroke rates were up like 200%. So their recommendation was don't take it. You didn't read that. So there is a flip side. It's questionable. Certainly, if somebody has had a heart attack, there is some benefit to taking aspirin short term. There is a benefit. There is some evidence that it prevents a non-fatal second heart attack. But when you look at preventing death rates, there's no evidence at all, none, that aspirin helps prevent death. Okay? If one has high blood pressure, there's no benefit at all. They always say that, well, you know, what you're doing in natural medicine, you don't have the science to back it up. But yet, even when the science goes against the paradigm of what they're following in medicine, I don't see them ever change it. Especially when they're on a roll with, you know, humongous numbers like this. So that's the deal with aspirin. It's a drug. It's a poisonous drug. You can kill yourself with aspirin. 10 to 30 grams, you can commit suicide with aspirin if you chose to. Okay? So it is a drug, and it is derived from an herb. White willow bark is high in salicin, and that's what the extract that they make aspirin out of. But aspirin is not a natural substance at all. Okay. Some of the side effects of taking aspirin, and there are some. Gastrointestinal bleeding. Aspirin is very irritating to the stomach and the GI tract. Traces of blood can be detected in a stool sample after taking one aspirin. One aspirin. And I've heard people say one aspirin a day can't hurt you. Increase in the risk of stroke, and I always find this fascinating because so many people are told to take aspirin to prevent stroke. I'm a little confused, I admit. Macular degeneration, long-term use of aspirin over 10 years increases your risk of the worst type of macular degeneration. Long-term use. Aspirin plus ACE inhibitors that are usually given for high blood pressure triples the death rate after angioplasty. This is medical research, okay? Another side effect acid reflux. Because of the irritation to the gut, acid reflux. Some people have asthma attacks triggered by asthma. It can happen anywhere from 20 minutes to 3 hours after taking aspirin. Aspirin affects the kidneys. Aspirin makes toxic compounds in the gut that affect the kidneys. One study of 100 elderly people, because it affects the kidneys more the older you are, 72 out of 100 showed kidney function abnormalities after only 2 weeks of taking aspirin every day. 72 out of 100. Okay. Probably kidney stress from aspirin is probably one of the biggest side effects there are. You can also get some liver issues, particularly if you combine alcohol with aspirin. Not a good idea. Ringing in the ears is the #1 reported side effect from aspirin use. And again, the reason for that is the stress on the kidneys. In Chinese medicine, they equate the ears to the kidney circuits. The eyes are on the liver circuit. But again, it's the stress on the kidneys that creates the ringing in the ears. We can take it a step further. Some people develop deafness with long-term aspirin use because of the stress on the kidneys. One of the side effects of long-term aspirin use is pancreatic cancer. The pancreas is where enzymes are made. Digestive enzymes are made in the pancreas. Okay, so it only stands to reason. We know it kills enzymes. So here it has an effect on the body's ability to make enzymes and affects the pancreas. Long-term use, large study, again, medical study, almost 89,000 nurses. 2 aspirin a day for 20 years. Pancreatic cancer was up 58%. Over 2 aspirin a day, it goes up to 86% increase in pancreatic cancer. Aspirin also increases joint degeneration. It does work as an anti-inflammatory. It does. It can help pain. There's no question about it. A couple alternatives to aspirin I'll mention, and this is not to give specific health advice, but a couple alternatives that really people ought to know about. If you want to thin the blood, you can do it with things like fish oil or krill oil. Work very well to thin the blood. Ginger is great at thinning the blood. Ginkgo biloba helps thin the blood. Vitamin E, there's other substances. There's foods that help. Melons being one of the best. Anti-inflammatory properties. We want to have an effect on pain, swelling. You know, we just had an injury, that type of thing. Bromelain is a proteolytic enzyme made from pineapple stems. It's a marvelous alternative to aspirin. When it comes to pain, usually, in my experience, quite honestly, usually the natural remedies don't work as fast as the pharmaceuticals. But in a severe, very, very painful injury, I'm not against doing the pharmaceuticals short term. And that's the way, you know, almost all drugs should be taken. You take it when you have to for a short a period of time, not every day for the rest of your life. That's where the problems arise.